Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of ENT is ENT Diagnostic Procedures. Procedures which we will discuss in our today's lecture are the direct laryngoscopy. Then we will discuss bronchoscopy and oesophagoscopy. So in the first section, we will talk about direct laryngoscopy. Scopy is the examination. So laryngoscopy is the examination of the larynx. We will discuss what are the indications of laryngoscopy and what are the contraindications of direct laryngoscopy. Then we will also discuss the position of the patient during laryngoscopy and what type of anesthesia should be used. And then the procedure and post-operative care and complications we will be discussing in this section also. So in first section, we will try to cover all the aspects of direct laryngoscopy, indications, contraindications, anesthesia, position, post-operative care and complications. All that will be discussed in first section. Then in the second section, another procedure known as bronchoscopy or examination of the bronchi, which can be rigid bronchoscopy and flexible fiber optic bronchoscopy. We will go over their technique, procedure, complications, indications, so all that we will be discussing about bronchoscopy. Then in the third, which will be our last section for today's topic, we will discuss oesophagoscopy or examination of esophagus. We will talk about rigid oesophagoscopy, flexible fiber optic oesophagoscopy, and then we will discuss transnasal oesophagoscopy. So these three procedures, which will be laryngoscopy, bronchoscopy, and oesophagoscopy, we will discuss in detail in our today's lecture. So keep watching sqadia.com.